On March 7, 2025, the Centers for Disease Control and Prevention (CDC) dropped a bombshell that's reigniting one of the most polarizing debates in modern health. A massive, large-scale study to explore any potential link between vaccines and autism. Reported by heavyweights like Reuters and The Washington Post, this announcement isn't just news. It's a seismic shift that promises to dig deeper into a question that's divided families, scientists, and policymakers for decades. Buckle up, because this is more than a study. It's a saga unfolding in real time. This isn't happening in a vacuum. The push for this study comes straight from the Trump administration, a move that's as political as it is scientific. With autism rates climbing and public unease simmering, the timing couldn't be more charged. A 2024 Gallup survey found that 13% of Americans, up from just 6% in 2015, believe vaccines might trigger autism. Add to that a current measles outbreak, over 200 cases and 2 deaths in early 2025, and the stakes feel sky high. This study could reshape how we trust vaccines for better or worse. Here's the rub. Scientists have been shouting from the rooftops that vaccines don't cause autism. A 2019 Danish study tracked over 650,000 kids and found zero connection. The Institute of Medicine's 2012 review? Same story. Study after study, rigorous peer-reviewed global keeps landing on no link. Yet the whispers persist. Why? Maybe it's the raw emotion of parents searching for answers, or the distrust in a system that sometimes feels too big to care. Whatever it is, this study's tapping into that unease and promising to face it head-on. Details are thin right now. The CDC's still sketching out the blueprint, how they'll run it, who's paying, when we'll see results. What we do know, they're likely leaning on the Vaccine Safety Data Link, a powerhouse tool for tracking vaccine outcomes. But don't hold your breath. Answers could be years away. When they arrive, though, they could rewrite public health policy or spark a firestorm if confidence in vaccines takes a hit. With measles already knocking on our door, the ripple effects could be massive. Not everyone's cheering. Critics like Senator Maggie Hassan are fuming, arguing this diverts precious dollars from uncovering autism's real roots. "We're chasing shadows," she said, pointing to a need for focus elsewhere. On the flip side, Kennedy and his allies are all in, insisting the data deserves a second look. It's a clash of priorities, and the CDC's caught in the crossfire. Advocates say it's about transparency. Skeptics call it a Pandora's box. Either way, the controversy's red hot. This isn't just another study, it's a lightning rod. As the CDC gears up, every move will be dissected by believers, doubters, and everyone in between. Will it finally silence the debate? Or pour fuel on a fire that's been smoldering for years? One thing's for sure, the answers, whenever they come, will echo far beyond the lab. So keep your eyes peeled. This story's just getting started. Enter the heavy hitters. President Donald Trump and Robert F. Kennedy Jr., the newly minted Health and Human Services (HHS) Secretary. Both have long waved red flags about vaccine safety. Trump's been vocal, musing in interviews that somebody has to find out why autism rates keep rising. Kennedy, meanwhile, took his confirmation hearings by storm, brushing off mainstream science as flawed and doubling down on the need for fresh eyes on old data. Love them or loathe them, these two are steering this ship, and they're not afraid to rock the boat.